Over the last 20 years, there's been an increase in allergies, and in particular in food allergies. For example, a recent study indicated that 1 in 3 people who react to peanuts and tree nuts aboard an aircraft are experiencing anaphylaxis. In 1998, the Federal Department of Transportation issued a proposal mandating that major U.S. airlines provide peanut-free zones for passengers with peanut allergies. But this proposed directive met with a lot of resistance and was never implemented. Hello, I'm Barry Eisenberg, Executive Director of the American College of Occupational and Environmental Medicine, and welcome to our program on anaphylaxis in the workplace. Reasons for the failure of this proposed mandate were varied. They included questions as to the practicality of trying to ensure that no passenger would ever bring foods with nuts on an aircraft. And would the designation of a peanut-free aircraft create a false sense of security? Given that it might be impossible to have a nut-free zone on airlines, there are many questions for passengers who have a history of allergic reactions. There are also many challenges for employees who are first responders while in the air. Our guest today is here to share his perspective as a former chief medical director of a major air carrier and currently as a consultant to multiple airlines. But before we begin, if you are just joining us for the first time, you can view all previous programs on demand at ACOEM.org. And feel free to email us with any questions you have along the way, and we will get back to you with answers from our guests or from the ACOEM team. Joining me now to discuss how airlines respond to anaphylaxis is Dr. Tom Faulkner. Tom, welcome to the program, and a pleasure to see you back here at ACOEM. Welcome.
Barry, thanks for having me.
Let's begin by talking about first aid. What kind of directives are the airlines under to help maintain the safety of their passengers and crews?
Well, Barry, actually, you referenced at the beginning about the change in 1998 from the Department of Transportation, and that was actually driven by the Aviation Medical Assistance Act that came out at that time, which was directed at looking at onboard medical events and how to respond, not only the training for aircrew, but also the equipment that was on board. In 2003, an advisory circular from the Federal Aviation Administration, or FAA, came out with directives that specified what equipment and medications must be on board, and also the training that flight attendants must undergo for those carrying passengers in the United States. The training basically indicated that initial and recurrent training for flight attendants had to be regulated. It had to address common medical issues, and also it had to address what was in board the what they called the new or the Enhanced Emergency Medical Kit, EEMK. Understand that prior to that, the flight attendants were and still are trained in using the basic, what we call grab-and-go kit, which often will have over-the-counter medications and stuff to take vitals, things like that. The Enhanced Emergency Medical Kits have many medications and equipment to respond to serious events, and indeed flight attendants are trained in not only the basic first aid, responding to a wound, stabilizing a broken bone, but also how to do CPR and use the automatic external defibrillators that were also placed on aircraft following the 2003 circular.
Have the airlines on their own implemented some policies that would help them deal with first aid for anaphylaxis?
Well, it's interesting. They're learning as well, and they continue to learn following the events that occur on board, and then tailoring their training for their flight attendants on how to respond. So the EEMKs do have epinephrine available on board and or in them, and that is what the flight attendants will learn about and can help in terms of if there was an onboard anaphylactic event, getting that to appropriate medical professionals on board. Now, let me back up a bit by saying that the FAA considered that roughly 85% of flights in the United States would have a medical professional on board. That could be an EMT up to a physician. Those EEMKs are not to be opened and used by flight attendants, but can be turned over to onboard medical professionals to administer those medications. Further, many of the large carriers in the States do have air-to-ground medical assistance, whereby there's communication from the airline or the aircraft patched down to emergency room physician on the ground who can then direct the care in the sky. So it has come a long way in terms of helping to respond to emergency events such as anaphylaxis.
Tom, in instances where training is mandated, whether it be by the Department of Transportation or by the airline themselves, would that training typically include training for anaphylaxis?
In the initial circular that came out in 2003 did not specify anaphylaxis. But since that time, I'm sure many airlines have seen that this is a very important event. And again, especially with the occurrence of peanut allergies and other allergies on board, so have directed their training to respond to those events.
So how big of a problem is this? Are there any good studies or statistics available on the incidence of anaphylaxis on commercial airlines?
Well, prior to HIPAA, there was greater data collected, I guess more specific data going on onboard medical events. Since then, they still are gathering data, either the airlines themselves or through their ground-to-air medical assistance services that will gather the information, what's used in the kit, et cetera. Recent studies have shown that 1 in 3 passengers who have a history of serious allergic reaction have experienced an anaphylactic reaction while traveling.
Tom, let's just say, for example, that I was an individual that had a history of severe allergic reactions. I'm getting ready to become a passenger on an airline. What advice would you have for me?
Well, good question. If you have a history of a serious allergic reaction or family member does, it's important to contact the airline first. See if they have any provisions or policies to accommodate those with allergic reactions. Many still do. When you get on the airplane, talk to your flight attendant. Explain to them your history of allergies and concern about exposure. And they are very good about accommodating passengers there. While there are still peanuts served on flights, they can make sure that you and your row often will not be served with peanuts or other possible allergens. Finally, have your epinephrine auto-injector readily available. That doesn't mean in your overhead bin or down below, certainly, but readily available so that if you do get exposed and start a reaction, you can respond appropriately.
So, Tom, you're saying that epinephrine auto-injectors are in fact allowed on aircrafts. Are there some special issues that I should be thinking about when I'm going through security?
Well, good point. The TSA will allow epinephrine auto-injectors, much like many other medications. However, they have to be in their container, they have to be clearly marked, they also have to have the patient or passenger's name on it and the prescribing doctor's name on it. So if it's not in its packaging or is missing that marking, don't be surprised that the TSA does not let you travel with it.
Tom, you've obviously gained a lot of experience in the airlines industry dealing with anaphylaxis and other allergic reactions. Are there some lessons for our members out there looking who work in other industries that you would be able to share?
Well, a couple things. The airline or an aircraft is not a hospital at altitude. It's a contained environment there with you can't get down to ground very quickly. There are resources on board, but the key thing is for employers and their employees to know about these reactions, how common they are, and how to respond, how to protect the individual, and then also how to respond. If they're traveling, they see someone involved with an anaphylactic reaction, how to respond.
Tom, thanks again so much for being with us today. Clearly, you've learned a lot about anaphylaxis in the aviation industry, and I know there's some good lessons that all of our members can learn out there. Thanks again for joining us. Before we go, if you are just joining us for the first time, you can view this program and all the previous episodes at acom.org/anaphylaxis. And feel free to email us with your questions along the way. We will get back to you promptly with answers from our guests or from the ACOEM team. Thanks for watching our series. And if you haven't already done so, be sure to make anaphylaxis an employee health priority in your workplace today.